Good evening, and thank you for watching Green Watch. Tonight, our topic of discussion is Black mental health in America. I'm your host, Treasure Mitchell, and with us we have Danielle White, MED, doctoral student for counselor education at Sam Houston State University, Dr. Camila Rahmaan-Russel, MD Adult Forensic, attending psychiatrist at Harris County Jail, and David Manning, counselor at the International Leadership of Texas. Thank you so much, guys, for joining us, and welcome to Green Watch.
Thank you.
Thank you for having me.
You're very welcome. So, if you could start by introducing yourself, giving a bit of your educational and professional background.
Okay. So I'm Danielle White. I attended Lamar University to receive my master's in mental health counseling, and now I'm pursuing my doctorate degree at Sam Houston State University, and I've been working within the field within over 5 years now.
Awesome. Thank you.
Hi, I'm Dr. Camila Rahmaan-Russel. I attended psychiatry residency here at Baylor College of Medicine. I work at Harris County Jail as a psychiatrist.
Awesome.
I am David Manning. I am currently in school pursuing a PhD in clinical psychology with a concentration in forensics. I also hold a license of licensed professional counselor, and I work as a crisis counselor for a public charter called International Leadership of Texas.
Awesome.
Yes, ma'am.
Thank you. So, I'll start by asking, the title of this show is Black Mental Health in America. And can you tell us how that differentiates from white mental health and just...
So when you think about Black mental health in America, for myself, I believe is perceived of really set from the environment. Environment from white mental health and Black mental health is really pretty much different. A lot of trauma somewhat happens within the Black community, and so it's likely that 20% more people of color are diagnosed with a mental health disorder, but really goes untreated due to the fact of the Black culture, which is you keep everything in the house, we pray about it. So I'm not sure how white cultures handle that situation, but I'm for sure for Black culture, it's pretty much different with how they handle mental health.
Okay.
Yeah, I agree. I think that really understanding the different cultural components, socioeconomic components, because those can be beyond just culture within itself, and that those all play into how Black people are diagnosed, treated, how we address mental health, whether we see it as an issue or not, whether we understand it. And, our primary diagnostic criteria is based off of like a white middle class socioeconomic group that is not necessarily consistent, or some of the diagnostic criteria, things that we look for, aren't always the same with Black people as they are with other people. It's not just white people. I think that understanding that cultural differences exist, and that presentations may be different based on the patient population.
I have to agree with them. I can't think of the man who I heard speak about it, but I enjoyed this concept. And he talked about it in the concept of inertia, which is like a force that is moving. And if you can appreciate the American experience of Black people, and I won't go all the way back to slavery. We'll go like 40 years ago, 50, 60 years ago to like the Jim Crow. There were people living during those times that today are your senators, politicians, CEOs of companies. They became to be advanced in society through the hardship and heartache of Black people. Yes, 40, 50 years later, you can fast forward and say we have a Black president, but the historical residue, and again, I didn't go back to slavery. I'm talking about the historical residue that is a few decades ago. It impacts us in a way that we are not allowed to appreciate realistically. Like, we can discuss it because it is fact, but we can't appreciate it for the trauma that it really is.
Awesome.
Yeah, I kind of want to add on to that, like even thinking about how the 1980s and 90s affected black families in like the prison industrial complex and mass incarceration. That if you think of at least, 2 generations of children growing up with the normalization of having absent parents, that like the psychological effects of that, I think that we are not even appreciating now. And this has specifically affected black people.
Okay, because yes, I totally agree. Also, there's so much black mental health like issues within the black community that because the level of trauma we've been through, that experience is just normalized as the black experience. Like severe depression is like just your teenage years. Like it's just normalized as the black experience so often. To see a black man go through so much as a little teenager and never cry, and no one ever challenges him on, hey, why I never see you shed a tear? Like, crying is human. Everybody cries. It is a human response. One of the tests that they do on babies when they're born. That probably is one of the biggest issues when we talk about the difference between black mental health and white mental health, is the primary fact that we do not even recognize it. Like, we do not recognize what mental health issues look like within our community because of how we've been educated in such a way and socialized to appreciate them to look.
I think it's also based off of the stigma. That people didn't want to recognize that mental health actually exists within the black culture. We pretty much normalized that, okay, black men don't cry. You don't cry. You have to be a man about whatever situation that's actually take place. And women, you're supposed to be the strong one within your household. So when mental health occurs, or she has anxiety or he has anxiety, or they're battling depression, oh no, you go in the room, you fix your face, and you walk back out like nothing ever happened. And so now it's when it's actually head front at the door, no one knows what to do. So you just remain silent, because if you mention it, especially if you want to go back years ago, I don't know if you all, but most people had that uncle that stayed in their room, and no one really wanted to talk about that uncle because he was battling some type of depression, anxiety, went to war, or any things of that nature. And no one paid him any attention.
Substance abuse.
Exactly.
Yeah.
So if I bring to the storefront of, hey, this is what I'm battling, I don't want someone now to label me as the crazy one in the family. So I'm just going to continue to remain silent within everything that I have going on within myself. And until we actually take the mask off and show that having a diagnosis is not that bad, and you can still receive treatment and be healthy and have a normal life with it, we're going to continue to have this same process go from generation to next generation.
Yes, ma'am. I want to bring it a little more current. As an activist, I have protested police brutality on many different levels. However, it was brought to my attention recently that social media is almost creating like a PTSD for black people. Us seeing that numerous times a day, almost on a daily basis, police murdering, police brutalizing, police just, in very bad interactions with black people. And what do you think about that?
I think actually because of where I currently work, I'm seeing it from the other side of individuals who actually are incarcerated. And so when you hear PTSD pertaining to police officers, if you're from the outside world, or you're not within the mental health community, or you're not an activist, you might just brush it off as, oh, they're just scared because they've experienced that. But those individuals actually, I believe, I'm not someone who can diagnose someone, but actually believe that they do have that trauma attached to it. And it is something social media does. I mean, just this morning, I was on Facebook and I kept looking over and over, and I seen about good 5 of individuals being harassed just from living their everyday life as a black person, and police are taking the side of the other individual. And it has to be addressed in some way, shape, and form. Is it going to be a diagnosis? I doubt it. But just because the times are changing, we have to bring it to the storefront that PTSD associated with police is definitely something that needs to be recognized.
I think that specifically with the constant images of seeing black bodies murdered and killed. I think I've heard this argument before. So I think clinically, can I say that it's PTSD? No. But I can say that it can be traumatizing, and it can it can activate something inside of someone that maybe they weren't prepared for. I also, though, think that this is where it gets difficult for me, is that I also think that it's important that one of the things why this is news to the rest of the world, what we've known for a long time, is because of social media, because we have live, because we can't run away from it, right? So the rest of the world gets to see, almost like Emmett Till, what has happened to us, right? And so in some ways, I hate to say that it's important and unfortunate at our expense, but, and I don't want to necessarily say that it's a good thing, but I think that the presentation of it has allowed us, or has allowed America not to ignore what's going on with us. And it brings it into their homes, to their phones, and they can't escape it either. So, part of me feels like, well, if a few of us, then don't look, but it needs to be seen.
I think also if you look at it from the standpoint, not even just Emmett Till, but Rodney King, if you bring it a little bit closer, as well as just if you don't have the assistance of cameras, then no one would actually know exactly what took place. But because of the criminal justice system and individuals not really being treated fairly, cameras are needed. So it could be a teaching moment for the next generation, or just the generation within itself, to know exactly how to take place when they are pulled over, or how to handle the next person. And does it traumatize the next person? Yes. For myself, I wonder every day, if I'm getting pulled over, what should I do? Should I put 10 and 2 and how I should move around with the police officer? So, but again, I don't diagnose, so I can't say PTSD. I would think PTSD, but DSM probably wouldn't agree with me.
It definitely influences the way that you think about the problem and you think about black people. I won't even say traumatizing. I'm going to say that it influences the way that you think. A lot of media, and I won't just blame it on media, because before social media we had the news, so I'll just say media portrayed us in a way that made black people scared of black people. Black people say black people get on their nerves too. It provides the availability heuristic. Heuristic is like just your cognitive process. And the availability heuristic means that the way you think is influenced on what's available to you. So because I'm scrolling up and down and I see how people who look like me are treated, it conveys a message. I'm not saying what message, but it conveys a message to you about this demographic. I was listening to a Nipsey Hussle interview, and it was very good. He was talking about gang culture, and he said that he was talking about self-hate. And this essentially is what it is. He was like, when a guy goes on a mission in gang culture and you're looking for, somebody to do some harm to, or somebody to make a move on, when you go into the next hood, you see a white guy and you pass him up. You see a black guy wearing, who thin, who don't really look like he know what's going on, you pass him up, he lame. And then you see somebody who kind of look like you, got your structure, walk like you walk, probably listen to what you listen to, and that's the one you do your move on. So like subconsciously, like it's a self-hate, the way that we move. And it has a lot to do with the media, the types of media that's available to us, and those images that we never really challenge. Black people will tell you, again, how dangerous black people are. And that got a lot to do with the media and images that they never critique, challenge, or try to oppose.
Yeah. So, as you were mentioning, you can't actually diagnose. Um, the DSM-5, I believe, is the one that's used currently. Can you explain what that is and your thoughts on it as it pertains to Black mental health?
So the DSM-5 is something that clinicians, I think psychologists use as well to make a diagnosis. Not psychiatrists. Y'all do? Oh, okay. To diagnose individuals from different time periods of what their symptoms are to give a certain diagnosis for that patient to have or a client to have. How I relate it to the Black community? I feel as if there should be a totally different DSM-5 based off of certain things that the Black culture do experience. Just because some things does not line up. Just because you have depression or you have anxiety and they have a time frame where you're supposed to have it, or they might call it situational depression or anxiety. To me, it feels as if that the Black culture is kind of put into this box with everyone else, and it's not recognized sometimes when based off of a book that people from years ago that I don't believe actually used or brought to the knowledge of Black people of color to create this diagnostic manual.
What does it mean, like exactly, DSM?
Diagnostic Statistical Manual of.
Okay. Just wanted to clarify for our viewers.
Sorry.
It's okay. Same question for you.
So yeah, it's a. Do Black people repeat the question?
Oh, I apologize. It was about the DSM-5 and how it relates to Black mental health.
So I think that we need we need criteria, right? I would say that it is important that, like, that the group of people who came up with the diagnostic criteria, who are working on an international committee of mental health providers, that when they came up with it, they were taking a lot of things into consideration. I don't know that I necessarily agree that we need something different, right? Maybe we need more diagnoses, and there were a lot of things that have been removed and added. It's also very, the DSM, this is the 5th edition. There have been multiple editions, and depending on what's going on at the time, like homosexuality used to be a mental health diagnosis. Obviously, it no longer is. And then there are other diagnoses that did not make the cut, at least this time around. I imagine there will be a 6th edition. But I think that really expanding our understanding, even if I think of depression and how things present and how they may present differently for Black people. In particular, I know that when I deal with a lot of Black patients, Black women in particular with depression, that what they are reporting is not necessarily what other groups of people are reporting. I also see this with a lot of my Latinx patients, that they may have more psychosomatic symptoms, that depression may present as like body aches and abdominal discomfort, and that we don't necessarily see that with like Black patients. That Black people often identify, just culturally, depression as sadness. And they're like, I'm not sad. But how are you showing up? Like, I think that to appreciate that, yes, maybe, but are you angry? Are you...
Irritable.
Yes, irritable. How are you eating? How are you sleeping? That we're looking, how many people really meet diagnostic criteria for depression that never identify as being sad or are never seen as sad.
Self-medicating.
Yes.
And so to think of it more holistically and to expand, I think, and to really, and I think that this is a clinician thing. These are the people who are treating, that are we thinking differently, right? And I think that that's where the deficit is, that the people who are treating if you stick strictly to it must look like this, or because I don't meet, because you have 5 criteria but not 6, then you actually don't need help. And I think that that's where we kind of go wrong a lot too. So just that there's an expansion, but also that as clinicians, even as family members, friends, the community, that we really are thinking of things differently. We know when somebody's not okay. We know the crazy one. You might not be able to identify what it is,
Right.
but you know something's wrong with them.
Exactly.
Right.
True. But to not be given like the space though, to actually say that out loud is different. I kind of agree with both of you, and I know both of you have very different takes on it. One saying that it needs to be improved upon and expanded upon, and then the other saying that we need to create our own. I kind of agree with them both. They both need to. So here's the thing, and this is why it's tricky, because I find myself in the same space about the Constitution and mass incarceration. How do you work within a system that fundamentally was not built for you? How do you make yourself exist? Do you stay in and try to change it from the inside to make it better, or do you accept your exile and create your own? Do you accept the dismissiveness and create your own? Do you accept not being identified and create your own?
Are you asking that?
And I mean, to me, it's a philosophical question, honestly, because neither of the approaches are wrong. Would it be wrong if the DSM-5 was based off of majority black experience? And then you would diagnose white people and all other Americans according to this? Would that be wrong? You see what I'm saying?
I don't know if it's wrong. I mean, I also understand we have to have a standard. But I think that, yeah, in the same mindset, like, it would miss how other people present illness.
Yes.
So, and that they would be coming up with like some of the same limitations that we often are.
It would, which is why you don't abolish theirs, but you just create your own. But hypothetically, I was saying if theirs didn't exist and it was only ours, seeing as how it is international use book, the codes they correlate. So, and the majority of the world is 2/3. So for that to be majority American, African American population that we were doing the tests on and assessing. See, the thing is, you've never been on the other side of that experience. You understand what I'm trying to say? Like, and because you haven't, it's very difficult for me to, because we have not been on the other side of the experience, it's very difficult for me to say that we shouldn't create our own, because we don't really know what that looks like. Does that make sense? Like, it's hard for me to, when I hear Angela Davis used to speak about abolishing the prison system, it's hard for me not to agree with that. Because like, it was not created with you in mind. It's very, and I'm one that don't really like to blow it up to fix it, but it's hard for me not to agree with that. Like, how do you fix something that didn't start with you in mind? Like, it's hard for me not to agree with blowing up the Constitution and rewriting it. It kind of makes a little sense. Like, now that we are all able to have a conversation and all parties are now being equally respected and involved, why couldn't we? As we know, it was written by men. We are still men. We could write another one. It's only work. And that may be too simple, but that is philosophically the way that I understand it.
Awesome. I believe you mentioned it earlier, how religion may play a part in mental health. Do you believe that that especially to be true in the Black community?
I think that, yes, I think it does play a part. It could be a good thing or it could be a bad thing. You could automatically assume someone believes a certain way and believe that this is how they should handle it. They should immediately run to the church and fix it that way. But not necessarily everyone who is Black relates to Christianity.
Okay.
And so I don't believe people should put everyone into that box. However, it could also be a good thing and a bad thing. I feel as if you can see a psychiatrist, go to a therapist, and have Jesus or Allah or whoever that you believe in all wrapped in one. If you need some assistance, you should be able to go seek that assistance. I think because of the stigma of, I don't want to say back in the day, but yes, back in the day with our grandparents and how things worked, and they ran to the church for everything. That has been the way that traditionally within some cultures, it just kept going passed down from generation to generation. Recently, I just did a seminar over at a Methodist church here in Houston, and come to find out those young adults actually went to see therapists. I was completely shocked about that, but because times are different. But if you go speak to older men and women, oh no, baby, they still relate back to, you don't. I'll just pray about it. I'll open my Bible and point somewhere, and Jesus will help me along the way. And that could be true. However, you might still need to go get some medication and go sit down and talk to somebody else, because that pastor or that priest or that what is Muslim?
Clergyman.
Mom?
Imam.
Might not have that type of education that will be able to assist you along the way. So I think you can have your religion, but you can also have your psychiatrist and your therapist as well.
Awesome.
Yeah, I agree. I think that it doesn't have to be one or the other, like from just my viewpoint. And this isn't true for, I've also dealt with people who, as a psychiatrist, when I have people who have really biologic illnesses, right? Things that there is a neurologic deficit somewhere, right? And that we can't, we can't address schizophrenia with prayer, right? Like it's just not going to happen. Like to really treat it, we need antipsychotics, which are problematic within themselves. But I don't want to dismiss that and act like I'm completely pro-medicine as a doctor. But I do have an understanding that to help people function, that it has utility. However, even, saying that, and I will have people come to me and they're like, well, I don't want any of this medication. I want natural stuff. And it's like, I don't know that it has to be one or the other. I think that we can do both. If you believe that your rosemary tea tree oil is treating your anxiety, I don't care. If we do it in combination with the medication, with therapy, I think that's another thing. Like it is either give me a pill or I don't want anything. And actually a misnomer that we are, part of our treatment. I also think that in a lot of contexts, Black people are over-treated, over-prescribed, over-medicated. But to stick on point to the religion part, though, I just don't know that it has to be one or the other. Now, I think one of the things that we miss sometimes, even telling Black people to go to religion, to go to church, is that religion can actually be traumatizing for a lot of groups of people. Mm-hmm. That going to church is actually what is associated with the depression, with the suicide attempts. Depending on where you fall in society, that might really be a terrible idea. Mm-hmm. And if we are just taught this kind of basic American cultural competency that says Black people are more likely when you're dealing with Black patients, because this is how we're taught, right? Mm-hmm. Consider that their spiritual group, there are test questions that will add which group of people, and it's mm-hmm. That's not actually always accurate. Sure. And that we're missing a lot. And like you said, that a lot of us don't go to church. We might be atheists. We might be Buddhists. We might, and we're missing so many things. And to not appreciate the complexity of who we are. But I think that to be fair, we also understand that there is the significant majority of us, even if we're not actively involved in religion, see Christianity as the way it's supposed to be, right? And just to take into consideration like how we're dealing with people that we love, how when we're seeing providers, that should be considered as well. But again, that it just doesn't have to be one thing or the other, a combination.
That was great. That was great. Can you give me that question one more time?
Sure. Religion and how it relates to Black mental health.
How does religion relate to Black mental health?
Like, do you feel like there's a big difference in the way religion affects Black mental health versus other races?
Not necessarily. I almost think to a degree that they are the same. It takes a level of belief. Part of why religion has existed for so long is because it worked to a degree. And when I say worked for Black people, I mean they were able to cope. Black people as a collective conscious became better through times of slavery when the only thing they had was religion. Like, it allowed a people being treated inhumanely to keep their conscious sanity. It was to their benefit. The issue with religion today, even though upward of 70% of us still go to church and identify as Christian, is the truth that we don't believe it. That's the issue. We go and we verbalize self-identity as Christian, but we don't believe it. Fundamentally, that is the issue. People who believe it, who really believe it, religion works for them. Still, like it did 300, 400 years ago. It still satisfies their psychological deficit. It still works for them. The issue today is we do not believe it. It's ritual, it's tradition, it's something that I'm culturally pulled to. Society tells me this, but I do not believe it. This is why when I need it to work like it's supposed to work, what it's supposed to work for, it does not work for me because I do not believe it. For that group, they need to see the professionals at the table.
Interesting. I find it unsettling that you say that it worked for so many years. It worked in a way that it kept our ancestors enslaved. It worked in a way that it caused them to not fight back like they should have. And I think that currently it still does the same thing. It pacifies us to a point where we hold ourselves to moral standards that no one else is holding themselves to. And instead of fighting back, instead of at slavery times, I mean, I think murder was definitely an option, a very good one. Definitely at least running away. They were again pacified by the fact that once they died, that their justice would come in the afterworld. Whether you believe or do not believe that world exists, this one definitely does. Mm-hmm. And so we have to change this one currently. That's why we're having this conversation. But moving on, I'd like to talk about, I'm sorry. I actually got very emotional about that, and I forgot the question I was about to ask, so I'll pull it up for just a second. But yeah, with Harriet Tubman coming out, I haven't seen it yet, but I did see the Nat Turner movie, and that, I, again, can't say it was PTSD, but I remember seeing scenes in the movie when Nat Turner was used to pacify slaves who were rebellious, and he would use a scripture to cause them to do whatever the master needed them to do. And seeing that happen was very saddening, because I feel like that's what's happening today here in America, is that so many pastors are speaking badly about our activists and speaking badly about the millennials who are actually talking about fighting back and trying to get them to, again, just lay down, listen to what Master says, and everything will be okay, in the afterlife, where there are streets paved with gold and all of that good stuff. Give me just a second, guys. Okay, so do you as Black mental health professionals feel like you have a higher obligation to the Black community than your counterparts that are not African American?
Yes, I do.
Definitely.
I do. Because it's my demographic. And this is the part of honesty that I like. Your demographic matters most to you. This is why you see more women in feminist groups. This is why you see more Black people talking about Black Lives Matter. Your demographic matters most to you. This is why you see more teachers on the front line of teachers' unions. Your demographic matters to you. And because my demographic is Black, yes, I feel a certain level of obligation within my profession of being a mental health professional to, find out about the wellness of Black people.
Awesome.
I 1000% agree.
Yeah, I think that even the motivation, and I don't know if you guys can agree, but to sacrifice so much through education, to give up a lot, to keep moving forward when school is hard, when we have life. And just understanding, I remember being in school and not knowing, this is even before medical school, not knowing if I was going to get in, and remembering thinking I have an obligation, no one's going to take care of my people the way that I'm going to. I'm very clear about that. If I don't persevere, I'm giving someone else the opportunity where I should be. And they're not going to feel the same way about my folks that I am. And I know that the privilege of being in a position where you can go to school, where you have access to financial aid or whatever, being aware of that, but still remembering what my objective is. I work at the jail. I could work anywhere, right? That is intentional. I actually, people who went to residency with me know, I was I am going to be a corrections psychiatrist. That is what I'm going to do. Because it's personal from the standpoint of just being a Black person in America. It's personal. I don't think I've ever met a Black person in my life who don't have somebody in their family who's been incarcerated at some point. None. Maybe it isn't a close family member, but somebody that's been to jail or has been locked up. For me, I have my brother has been incarcerated since 1994, right? I don't know how long that is, a long time.
Ago.
So, over 25 years. I have another brother.
Exactly 25, right?
Oh, there we go. Is it? Okay. I have another brother who was first diagnosed with mental illness in LA County Jail. And so it's personal. And I think that just an obligation to be there, but the obligation to also understand, I've never been incarcerated, but people I love have. Intimately, right? The people who grew up in my house with me, and seeing how being behind bars has affected them, but also seeing how really having people who are there and present and believe in it, my patients feel it. Mm-hmm. They know that this isn't just a job for me, it's personal. When I say I'm gonna do something for you, when I tell you that I'm disappointed, when you know that I'm showing up and that I care, they feel it. Because I'll go to bat for them. I want them to be treated a certain way. I know that other folks will not say nothing. It's important to me to make sure that I'm advocating, because we're advocates for the people that I care about the most. So yeah, we have an obligation. I think it also makes us better.
Yes.
It makes you work harder when it's personal. Mm-hmm. It makes you work harder when you look at a 17-year-old scared black boy in jail and think of your little brother. It's more than just a job. And I think a lot of black people kind of have. It also can cause us to deal with a lot of extra stress and to affect our own well-being in ways that I think are important, like as caretakers, burnout, that it's real.
Definitely. I agree. I agree with both. It's personal for me where I work currently, and it's personal for me for why I even chose this profession. Just because I work within the jail system, but however, I also have a physical disorder, a diagnosis, and I knew how I was treated within just the hospitals here within Houston of not necessarily being pacified, but not really caring about how my mental health was when I went through the process of having a diagnosis of an autoimmune disease. And I saw how my other counterparts were being treated. And so when I used to go to those support groups, knowing that I was the only black person in the room, wanting to seek some assistance of how I was going to handle with my body not being completely balanced like everyone else's is. And I knew if I wanted to change how that looked, then I needed to do something about it, which is the reason why I chose this profession from that side, but also going into working within the jail system also allowed for me to see it from a personal standpoint of just being that family member of that loved one or that uncle, that daddy, whoever was actually within the jail system.
Awesome. So I'm not in mental health, but I am an educator. And so I do deal with special needs, special education children. And this is just my perception. So I wondered if you guys could clarify if this is actually accurate. But it seems like black children are almost over-diagnosed and over-medicated, and black adults are under-diagnosed and under-medicated. I have several children. It was mind-boggling as to why they were labeled as SPED until I met their mother. Oh, now I see why. And so, like I said, that's just my personal perception. But what are your thoughts on that?
When it comes to adults, because that's what I work with, is adults. And again, the population I work with are in the jail system. So you have some people who are untreated and just they have a diagnosis. They've seeked out assistance, but for personal gain, maybe within the community because they can receive Social Security or anything like that nature. And so the diagnosis is there, but do they actually continue on with the treatment? That's something that's actually up to them. So they could actually be labeled as having a disorder, but when they leave out that doctor's office or they continue on with the education and the treatment as what was actually prescribed by the doctor. So that could be the reason why when you see it, when it trickle down to the child, they want the child to get diagnosed. But because I know for sure within Harris County, if you have so many diagnoses with the child, you can go receive some type of check and you can get some extra income within the household. So it could be also in that way for personal gain of why they want their child diagnosed and why they remain undiagnosed.
Well, you work with children.
Yes, you work with children, so go.
I'll let you go.
The question is, so I'm going to speak about children. Yes, I see kids that I believe to be misdiagnosed. If I'm being honest, not just black and brown kids. I see children being misdiagnosed a lot. I actually see a lot of underdiagnosis too. There are a lot of kids that deserve assessments, that deserve to be evaluated because they do show signs or symptoms rather, and they have missed, however mildly, developmental milestones, and they should be assessed. However, because some communities and populations are not okay with labeling certain kids, then you kind of meet that resistance, and this has a lot to do with the misdiagnosis because of the increase in privilege and opportunity that has been given to teachers to kind of influence diagnostic criteria by identifying signs and behavior in their class. This has led to like an increase in misdiagnosis and underdiagnosis.
I think that, and I have worked with children. I don't currently, and I do have some adolescents. We have a lot of adolescents and people with intellectual disabilities who I treat now. But when I've worked with children in the past, I know that one of the things that always kind of stood out for me, because I agree, I think that there's misdiagnosis and underdiagnosis. And so I can see it both ways. But children often, that manifestation of whatever they're going through usually presents as behaviors, right? And so when a child is acting out in a classroom or is brought, to the attention, one of the things that for me is essential that I think that we miss by only looking at the result is kind of what was going on before. What has been going on in the household? I have treated kids who just clinically for ADHD don't make sense to me. And when they're showing up with symptoms at 15, 16 years old. And then it's like, well, I don't understand why suddenly this is a kid who's done well in school their whole life and suddenly they have ADHD and they can't sit still in a classroom and we're giving them medication, and whether or not it's working, what's going on prior to this? I think that is, as clinicians, like we're just being overwhelmed by this is the teacher report and the parenting report. And I am thinking specifically about someone that I have dealt with before. And it's like, oh, my brother was killed. This is when I started. And it's like, has anyone ever asked you this in the year that you've been coming to this clinic? And it's like, no. And the mother's there like, oh, we didn't think that. And it's even the family not being able to identify it. So I think, and the mom's like, no, I didn't think about that. It's like, this makes more sense. This is trauma. Like, this is why he's acting out. We're missing that. Like, it just didn't make sense. And I don't even know if in scenarios where it does make sense, like, are we missing what else is going on? Is this kid coming to school hungry? What has he seen? Did he get to sleep last night because his parents were up fighting and arguing all night? And he's coming to class angry and grumpy. And then he's just disruptive and a problem. And that there just has to be some better way to holistically address the family and kids, I think, than what we're doing now. And that's where we're also, and yeah, I don't know if it's under treatment. Again, I can see it both ways, but, or over treatment. I don't know that, and sometimes, and honestly, if people need help and they are poor and you get this diagnosis, and at least if you were getting your kid who may need medication, who may need treatment, who also has access to therapists and counselors, and you get a check, I don't know that I necessarily disagree with that. Because I know that at least some of the other social supports in medical and access to care are being addressed too. And so, and I think that we kind of get painted that way, that like, and I know, but I don't know if that's true for the majority of us, right? And if someone's in the home, if they're a therapist coming to work with this kid who needs help with something, they're also observing the home, right? And the mom's going to talk to them. Sometimes the mom's going to try and like, monopolize the time because they're going through stuff too. So, but yeah, there is an undertreatment, but I also agree that sometimes you can lead a horse to water. A lot of people, especially if you have someone in your family who has a mental illness, in the sense that we like to think about it, that often one of the biggest challenges is getting to them, one, to admit there's something wrong with them, and getting them to comply with treatment. And you can give them a million resources, they might not follow up. So it's complicated.
Awesome. Okay. I'd like to know what you think the first steps are in addressing mental health and bringing about wellness and function to the Black community, to the Black family.
I think definitely just recognizing that something might be off balance within yourself and or within your loved one. If you just have an example of you and your friend have been knowing each other for years and you notice that he or she is not functioning the way they normally do, ask a certain question. And when they respond, I'm fine, and because that's the normal response that most people say, really don't be like, okay, and keep it moving. Actually acknowledge exactly what's going on. I'm like, no, you are not fine. No, something has shifted. Trying to dig a little bit more to see exactly what's wrong with that person versus continuing to remain silent with and continue moving on with your everyday life because of which we don't go into the suicide aspect of it, but because of people are battling things alone and continue with the I'm fine. Treatment is not being sought out, and people are continuing to have whatever they have going on within their mind over and over, and they might perceive, oh, no one cares because no one asked any questions outside of that one initial question, which is, how are you? So definitely just ask questions to your friends, recognize when things have shifted, and if so, walk alongside with them to receive treatment or receive whatever type of assistance they may need. If it's just a therapist, go to a therapist. If they need go see a psychiatrist, go with them to see a psychiatrist. Be supportive versus putting them in that box of, oh, he or she is crazy.
Mm-hmm.
Could you repeat the question again?
What do you feel like are the first steps of bringing mental health, wellness to the Black community, bringing back function to the Black family regarding mental health?
That's funny.
Yeah.
It's a little dysfunctional right now. I mean,
You were gonna ask for the functional time.
okay.
Me
So
too.
this is like Make America Great Again.
Yes.
Was it great?
Like,
okay.
we had
okay.
issues.
For a very long time.
Yeah, we're talking about them now.
Yeah. Okay.
That is the difference.
yes.
That's the only
Okay.
difference.
Very much
We probably have more issues.
Yeah.
Um,
More problems.
I think that the first step is really intentionally how we have our children. Yeah, it starts that early. I think that thinking about that, it has to start with the family. It has to start with how we think about future generations, how our children receive love, how we care for them, how we provide for them, how we are affectionate to them, that we don't normalize abuse, that we don't normalize like my mama just went upside my head and she cussed me out. That's love. I don't know if that's true. I think that sometimes your cultural norms go unexamined. Like, we got to challenge ourselves too. Like, we have to intentionally think about, like, yeah, it's our culture, but it's problematic. And that's okay. We can do that. We can support one another and see how we're mistreated and how we want more advocacy and more of a voice. But we also got to look in with more depth into how we are responsible
Contributing. Yeah.
to some of our own dysfunction. And I think from there, it's the Black educator. It is that, our children deserve to have people in the classrooms that look like them. And I'm not saying they only have to have that, but I think it's a problem if none of your teachers look like you.
Yeah.
From men, and this is for everyone, I think that children need positive examples of themselves, like that Freudian slip when kids come home and they say, Mom, or teacher, Miss Hernandez, to their mom. There is a connection there. They're an extension. And I think that starting there, we create better people. Starting there, we are really addressing Black mental health, that we're having, that we see the fullness of it, from identity to sexuality to expressions of so many things, that it just starts from birth. Like that attachment is real. That's why the fathers take their shirt off. They That skin to skin thing, yeah, it helps keep them warm, but there's something bigger than that that's
The
going
affection.
on. Yeah, in that moment. That
I would say that, actually, I would say that that's probably the first step, is for us to become more affectionate. Like, part of what you said, when you grow up in a culture or in certain households, we used to challenge them when we were within the household. We don't challenge them as much now. When you grow up in a household where your mother curses you out, but then you guys watch the movie together on the couch. This is kind of normalizing a relationship that is unhealthy and that lacks affection. Most of us, or at least lacks love. Most of us accept affectionate behavior as love. So if I push you down, which is an aggressive act, but then if I help you back up and hug you, which is an affectionate act, in the context of cursing you out and then us eating on the couch, I grew up in a loving home, and we're not really being critically fair to what happened to us. We're really not really analyzing that situation and that household experience. Part of why I posit is because we are now kind of in a cycle of that experience, and now it's our turn, and we're having our kids, and we're making them go through that same thing. It's hard. It's very hard to challenge something that I am also doing.
Awesome. Thank you very much. I liked what you were saying. It goes along with the quote where they say it's easier to build up children than to fix broken men, or something along those lines.
Douglas.
But yes, as an educator, yes, I feel the exact same way. I'm not a mental health professional. I'm not their parent. But yes, I've had students refer to me as mama, and then like they catch themselves because I do show them love and nurture them. To a certain extent, show them affection. I do have students that come in every day and hug me and want to hear positive affirmations from me. And I think that's very, very important, especially for our Black and our brown youth. Thank you for tuning in. This has been another great episode of Green Watch. Thank you to our viewers. Thank you to our guests. In the words of B.B. Moore Campbell, people of color, particularly African Americans, feel the stigma more keenly. In a race-conscious society, some don't want to be perceived as having yet another deficit. Thank you, and please watch your government because your government is watching you. Have a great evening.
With power, here they come, international loan sharks, backed by the guns of market-hungry military profiteers, whose word is a swamp and whose brow is smeared with the blood of the poor. Who rob life of its quality, who render rage a necessity, by turning countries into labor camps, modern slavers and drag as champions of freedom. Sinister and cynical instrument who makes the gun into a sacrament. The only response to the deification of tyranny by so-called developed nations, idolatry of ideology. North, south, east, west, kill the best and buy the rest. It's just spend a buck to make a buck. You don't really give a flying about the people in